So I live in the Carson Valley on basically the Nevada side of Lake Tahoe, and my demographic is largely a retirement community where people have moved to the area from California, and so my age demographic is really like 50 plus. When it comes to treating patients. And what's particularly interesting with this demographic is that they're really seeking non-surgical options. They really don't want it to hurt. No matter what I'm doing, they really aren't so concerned about the money, but they really want the easiest, safest, most effective way. And so those are the treatments that I seek out for my patients.
I have to imagine that a part of that community, aside from not wanting to have surgery, especially if they're retired, they've already had surgeries. But it's like, in order for them to lose weight, for them to work on their physique, is there an advantage to being able to offer them something that's...
There is no question about it. For these patients in particular, they're postmenopausal when we're dealing with my female population. And so losing weight becomes very, very difficult in this age bracket. Believe it or not, they're actually extremely fit. They're very physique conscious, where they do exercise. They are taking care of themselves. They do eat a pretty good diet. They like their wine at night. So they don't want to be told that they have to lay off the sauce, but they are really seeking body contouring in areas that no matter how much they exercise, no matter how much they starve themselves, which they are not interested in at all. They love to wine and dine at this age, and they deserve it. But they have trouble areas that they can't get rid of on their own.
So how do you address it?
So the way I've been addressing it with my patients is to encourage them to continue with a healthy lifestyle. But really, I'm not interested in telling them to not go to their favorite dinners and to not drink their wine at night. But we address it with a machine called BTL Vanquish. And it has been a real asset to our practice.
Tell me about it.
So BTL Vanquish, in addition to being absolutely incredible with results, what I love about it is that I can treat everybody. I don't have to discriminate against my patients based on their BMI. I really can treat everybody. I love that I can include everyone who really is seeking this treatment. It may take more sessions to achieve the result that they want, but they really do achieve a result. And as a clinician, it's really important to me that my job is really to under-promise and over-deliver. And BTL Vanquish over-delivers for me every single time, and my patients are ecstatic with the results.
So when you say that it over-delivers, what kind of results are you seeing? Like, are you measuring? Are you taking pictures? How do you...
So we do take before and after pictures. It's really important. We actually don't measure with a tape measure because it's really, really hard to get consistent measurements when you do that. But what I tell my patients is that, number one, their clothes need to feel better. They need to feel better in their clothes. They need to feel better when they look in the mirror. And it's the general debulking that happens for them and the beautiful contours that they get back in their waist. Some of these women haven't seen a waistline in years. I'm not kidding, like literally in years. And all of a sudden they get that pretty cinched in waist again. And they're really, really, really happy.
I'm curious what the patient experience is like. I mean, anything that's non-invasive, but you're getting pretty serious results. There's got to be some mystery. Like, what is this doing?
So my patients, I tell them it really is so painless that it feels almost too good to be true. And I always caution them, do not look at the scale for this being a measure of your result with BTL, because you're not going to get on a scale and week by week be losing pounds of fat, but it's the general sculpting of the inches that we're after. So the scale may not change at all, and my patients know this. It's a very gradual result over time. I treat my patients once a week for 6 weeks with BTL, and the positioning is really important. But in the before and afters with my patients, there are noticeable, measurable results even in my photos that we could measure after.
If you could compare it to other procedures, you don't necessarily need to name them other than generally like body sculpting or liposuction, because these typically are the things that people are looking into.
That's correct. So what I love about BTL is that it for sure has the largest treatment area on the market. So we can debulk a patient in that entire waistline that bothers them. And when the wings come out on the sides, whether I'm treating them from the front or the back, you get a very even contouring from 360 degrees around my patients. What's also tremendously important in this patient population is that their skin is not so great anymore. And so they have some sagging, some skin laxity, and with BTL, they really get the skin tightening that they're after, because if you remove fat for patients and their skin is not in the greatest health, their skin's just going to become looser, and we are not after that. We want to tighten these guys up all the way around, and so that's what I love, that you get the even contouring and that I can treat their entire body from the front and the back, and not have to be treating spot sizes of like a stick of butter at the time. You would never be able to even a patient out treating a stick of butter at a time, because my patients, if I say that to them, they laugh and they say, what do? I have pounds of butter to lose. I don't want a stick of butter to go away. I want 2 pounds of butter to go away.
Speaking of that, the smaller spot size with spot,
Mm-hmm.
isn't there something else that goes on in terms of like the difference between Vanquish and a spot treatment?
Mm-hmm.
Don't you get like weird lines?
You can get, it's really up to whoever is performing the treatment. You're only as good with these machines as the person who's actually behind the machine and actually performing the treatment for you. So with BTL Vanquish, for sure, the placement of this machine is very, very important. It's important as a clinician that you really understand what you're doing with Vanquish and take the time to learn how to use it so that you get those great results. But with some of these other machines, if you don't evenly treat from the stick of butter to the next stick of butter, you can really get some uneven results. And with BTL Vanquish, it's such a pretty even contouring that you get. And I know of no other treatment on the market that can do that.
Do you combine any other treatments, any other modalities with this?
So the answer is not in my practice currently, but wellness and lifestyle are a really, really important thing to consider with BTL. And so when we're talking with patients doing a body contouring machine, it's interesting what happens for them, that they're sort of they're investing a little bit to do the treatment. And then all of a sudden they decide that they want to be a little bit more careful about what they're eating. And they might park the car a little bit farther away from the grocery store and take a little bit longer walk or go for a walk at the end of the day when previously they weren't doing that. But skin health is super, super important. So I don't combine it with any other treatments, but I do combine it with good skincare for my patients. And I will often precondition their skins. If I'm treating off the abdomen, if I'm treating legs, if I'm treating arms, sometimes skin laxity is an issue, and I'll precondition their skin.
Can you talk about shockwave therapy with the Cellutone?
Yes, so that's an incredibly important part of this procedure, that after the treatment is finished, we do the acoustic shockwave therapy with the patients to make sure, again, we don't want any lumpy results. And when you're removing fat and putting heat in that area, there can be a phenomenon where your body has to clear out the cell debris of the fat that we're killing in that area, and can cause your white blood cells, or kind of how I explain it to my patients, they're Pac-Man cells, come in to eat up that cell debris. And sometimes if we don't use that acoustic shockwave therapy, those Pac-Man cells will clump around that fat and it gets really hard in a lump. So to prevent that, we use the acoustic shockwave. It doesn't hurt. My patients look forward to it. There are treatments with BTL once a week. My patients, it's so comfortable that most of the time they fall asleep and are snoring, and we have to wake them up when it's finished. So it's just tremendous.
Sounds great. This helps with cellulite, correct?
So the Cellutone helps afterwards. So that is, it's an investment that you make to prevent the clumping afterward with the BTL. But what's great is that you do have income potential to use the same machine for your patients to help with cellulite, and it's tremendous.
I guess the only other thing would be, could you speak about your relationship with BTL as a company?
Absolutely. I said previously that it's my job to underpromise and overdeliver, and BTL as a company has overdelivered for me. And when you're spending that kind of money and you're making an investment in a machine like this, you have to really feel confident that number one, the machine works and that you're going to be able to deliver the results for your patients. But number two, that the company stands behind those results and will give you the support that you need for anything that might happen with the machine or help you with marketing or questions. And BTL has really, really been there for me.